Hi, everybody. I'm Dr. Matching Forte. Today, I want to talk to you about breaking the cycle of chronic pain. Two out of the top three reasons that people go to their medical doctor is because they're in pain. Number two was joint degeneration and osteoarthritis. And number three was back pain. And it's no wonder why today we have so many people that are in chronic pain. In fact, estimates say that about 100 million Americans every single year are in chronic pain. I think I saw a number of about 2 to 3% of our workforce at any given time is in chronic pain. It's no wonder why we have an opioid crisis now that is really out of control. And so we want to start thinking different about pain and thinking different about joint pain, because clearly what we're doing isn't working. And we have to start thinking outside of the box a little bit here. One of the biggest mistakes I feel that's happened is people simply have just gone to the wrong people to take care of their joint pain. Typically the number one place that people are going to go first is they're going to go to their medical doctor. And quite honestly, most medical doctors aren't trained in the biomechanics of the body and biomechanics of how the body is supposed to work and how joints are supposed to work. And, joint pain and back pain, probably one of the most misdiagnosed and really a lot of times very complicated to diagnose joint pain properly. Most people, they don't get joint pain, they don't get chronic pain from an injury. Actually, there's a very small percentage of the people that get it from like a car accident or slip or fall or some sort of sports injury. You know what the most common cause of joint pain is? Bad biomechanics. What is biomechanics? People ask me, and it's just the ability for any joint, any spinal joint, any knee joint, hip joint to move within its appropriate range of motion and be able to function normally. For example, if a knee was supposed to glide nice and even on each other, if it would twist and start to glide differently, it's going to cause a wear and tear on that joint. And essentially, that's what's happening over time is people are not properly taking care of their joints as they age. And I don't mean just by exercising or stretching or things like that. I mean really having them aligned properly to make sure that they're working, having their muscles tested so they're working properly. Our office here at LifeWorks, we've got an integrative style of practice. We have rehab, we have chiropractors, we also have some of our medical team. So we can assess people at a much different level than what most doctors are, because we have all minds coming together. And really that's all that we see at LifeWorks on our physical medicine, chiropractic rehab, and in some of the injections that we do. We find that patients accelerate their healing process as a result of our process that we go through with every patient. And while our process it helps us get to the root cause of the problem, everybody's a little different in what they need, whether it's a knee, low back, neck, and so forth. But probably the biggest challenge that we're finding today with patients is that their musculoskeletal issues have not been managed appropriately as time has gone on. If you think about it, what is the first thing that you do when you get joint pain? You go to the medicine cabinet and you grab a Tylenol or an Advil or some sort of anti-inflammatory pain reliever. Does it help? Sure it does. Helps the pain. But what it doesn't help is it doesn't help get to the root cause of the problem and actually work on correcting that. Because eventually what happens is once that painkiller or that anti-inflammatory wears off, what happens to your pain? It comes right back again. And many times it's going to come back worse because that wear and tear has developed on the joints. Okay? And this is why we're seeing so many people today with chronic joint pain. They just simply haven't taken care of it, and they've always relied on just covering up the symptoms rather than handling the cause of the problem. One of the worst things that we can do for joint pain is think that we're doing okay if we feel good, right? Most people, if they don't have joint pain, they go about their day thinking that everything is fine. And then just suddenly, and knee pain or low back pain starts to creep up, right? It's this other part of where joint pain comes from, not from an acute injury, but from bad biomechanics. It's just that wear and tear. It's not old age, because what I can tell you is I've seen people in my office that we've looked at x-rays that have been in their 60s and 70s with really good, really healthy joints. They've taken care of them throughout the years. And then we've seen people in their 30s and 40s not take care of their joints. They've relied on the whole take a pill to get rid of the pain and they're healed again. And it's just not the case. What we're finding even more and more today is that the joints are degenerating, I would say, more rapidly than what they ever have. The increased amount of hidden inflammation that's in people's bodies from what we eat, from the wear and tear that we have on our body, is accelerating all this degeneration. And the autoimmune, or the immune system, is attacking joints and essentially wearing them down faster and causing a premature aging. The beautiful thing about our office at LifeWorks and how we handle it is we really have like a 4-step approach to working with joint pain and breaking the cycle. Number one, we know we got to help you guys get out of the acute pain, because that's what you came into us for to begin with, right? So our nurse practitioner uses certain injections to help to decrease the pain quicker. Non-corticosteroid. In fact, steroids have been shown to actually break down the joints, break down the tissue much faster than if you were to do nothing at all. They help with pain. Don't get me wrong. That will absolutely help with pain, help with inflammation. But we run into the problem of accelerating joint degeneration and tissue breakdown. So our first pillar of joint relief is decreasing that pain. Okay. Second is correcting the biomechanics. Now think of it this way. If you're driving your car and you got one tire that's a little bit flat, right? You may not notice it much as you're driving, but as time goes on, that tire is going to wear more. Well, it's the same thing with any other joint in your body. If the biomechanics, if things aren't right, aligned correctly, you're going to wear it down faster. Third component is our rehab. The one mistake that I think chiropractors or just physical therapists make is they only focus on the thing that they know best, right? They either correct the joint alignment or they work on the muscles. And while they're both very good for the body, when you combine them together, I believe you get a superior stability within that joint to help create long-term stability. And then the fourth pillar that we use for joint pain, and this isn't for everybody, but it's regenerative stem cells. And stem cells and the technology with stem cells has proven to really have remarkable results when it comes to regenerating the joint and preventing and avoiding surgery and future decay and degeneration. So I guess what I want to say today is that we have to start to think differently about joint pain. And we have to start taking a proactive approach versus a reactive approach when it comes to joint pain. You know, we can tie it in kind of with what dentists have taught us about our teeth, right? You don't wait to brush your teeth until you have cavities or you have stinky breath, because if you wait till that happens, you're always going to have cavities and you're always going to have stinky breath. We've learned to take care of our teeth. We maintain them. We're regularly brushing them and flossing them so they stay healthy, okay? We have to start doing that with our body, with all of our joints. We have to start maintaining our joints. Recent study found that with chiropractic care, with physical therapy or rehab or medical care, while chiropractic was the best at reducing the pain most effectively, physical therapy was just behind that. But they found that after 12 months, the pain typically started to creep back again. And does that mean that the chiropractic didn't work properly? No, not at all. Does that mean that the physical therapy didn't work properly? No. Where the fail point was that the condition was not properly managed long term. And this is because we've been trained for years that once you're out of pain, you're good. And unfortunately, it's just not the case. Some of you guys could be just in one step away or a bad day away from excruciating knee pain or joint pain or pain in your neck, mid-back, shoulders, hips, whatever it may be, right? But we have to properly and continually maintain our spine, our muscles, just as if you were maintaining blood pressure or cholesterol or your blood sugar. So we're going to start coming at you every week with just different health tips and help you guys to reduce your premature aging and reduce chronic illness and chronic disease. So until next time, be sure to like our Facebook page and like this post, share it with other people so we can get the message out about health and healing. Have a great day.